Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
All right, welcome back, everybody. Dr. Jitka Lom, the principal physician at ExpressCare, is here edifying us with many things. Dealing with strep throat. Now, doctor, as you were saying, strep throat can lead to rheumatic heart disease. It can also lead, as we'll now talk about, to possibly kidney trouble. How so?
Well, again, so the strep can create some interaction with your immune system and create what we call immune complexes. These are sort of like globs of antibodies and toxins, and basically go into your kidneys and create some damage. And the symptoms there are they can occur at any age, but it can occur in young people, for example, where they would suddenly have high blood pressure along with their fever, protein in their urine, and they swell, because when your kidneys aren't working very well, you'll retain fluid and you become quite swollen. So most of the time, this disease, if the strep affects your kidneys, most of the time that disease will be self-limited, meaning it will go away by itself in a month or two. But sometimes the children or young people actually do need treatment for high blood pressure or for their fluid overload.
Now, one thing I've wondered about, because I've heard it before, but they said strep throat can also lead to mono. Commonly known as, for those of us who don't have advanced medical degrees, as the kissing disease.
Right. So
very common in college.
Yeah. So mononucleosis, that is a completely different disease than strep, but they can both cause a sore throat. So if you have a sore throat, you could have strep or you could have mono. Mononucleosis is actually a viral disease. It's caused by a virus called Epstein-Barr, and we can check for it with a blood test to find out if you have that or not.
Which is a very complicated disease in and of itself.
Well, Epstein-Barr can cause many different symptoms, but the typical thing is that if you have it, you have a really sore throat, your glands are hugely swollen, and you have a fever. But you don't usually have pus on your tonsils, not that much anyway. And sometimes it's hard to tell, so we'll do a swab and do a blood test. But anyway, it can occur in young people, typically it's teenagers. And the thing about mononucleosis is that it lasts a long time. So strep, you'll take your antibiotics, you'll get better within a week. But with mono, there is no antibiotic because it's viral, and it may take a month, longer even, to recover fully. And they have tremendous fatigue, and they may have swelling of their spleen. The spleen is part of your immune system. It sits over here in your upper abdomen. And so kids or young people that get mono sometimes have a slow and long recovery.
Yeah, I was going to say, because like one of the telltale signs of mono is you always hear about some kid like in high school or in college, or you watch a news report and your favorite college athlete,
right.
They say, well, he or she will be out for a month
right.
from playing because he or she has mono.
Right.
And basically, like, she's in perfect health otherwise and everything like that.
Right.
She just sleeps for 16 hours a
day.
Yeah,
there's tremendous fatigue associated, joint pains. It's like a bad flu that just really, really lasts a long time.
And just the passage of time is the only thing to get over it?
It will go away.
That's terrible. Okay, so are there ways that we can live our lives that can hopefully prevent strep throat, or if we see the onset of strep,
right.
How can we combat that, hopefully with medicine or with behavior too, so it won't get
worse?
What
we want to do most of all is wash our hands and teach our children to wash our hands. And hand sanitizer is nice, but washing your hands is better. And when you're washing your hands, you want to use warm water and soap and and sing the happy birthday song, or at least take 15 to 30 seconds to really get the germs off yourself. And the more you wash your hands, the less likely you are to get sick. Now, so if you have a family member that has a strep throat or a sore throat, please don't share drinks or food. Wash your hands, don't share towels, and basically try to avoid ingesting anything that they're touching. Go ahead.
Question again, please. Okay, I am very appreciative of the fact that you said wash your hands not only with soap and then use hot water.
Yeah.
Why is it then that when we go to hospitals or many hotels or like malls, the water comes out and it's always ice cold?
Yeah, that's an issue, isn't it? So
is it just cheaper for the
I really don't know why that is in those scenarios, but it is warm water will get you a better result, okay, as far as cleanliness. But if you don't have warm water, at least do your 30 seconds. One tip for people who don't have warm water at home, which many people on Guam do not have hot water because they don't have a hot water heater or they don't turn it on because of the power. So one thing I advise them is, buy just a cheap small rice cooker and fill that with water and put that in your bathroom, plug it in, and then you always have a source of warm water just for washing your hands or your body.
Okay, hotels and malls, I guess we can, forgive them, because I mean it does cost a lot of money to offer, you know, warm,
Yeah.
hot water at that
Yeah.
level. But hospitals, it's amazing how, like, you know, it's basically only cold water is the option.
I'm not sure.
Yeah. Okay. Well, maybe we can talk about that. Okay. If a sore throat is not treated, again, going back to the garden variety thing, can it become strep, or what things besides strep
Yeah.
might it evolve
So
into?
let's say you just have your sore throat and you think it's viral, you kind of have a low-grade fever, maybe along with that you have a little runny nose or a little cough, then that's probably viral. It should pass within a week. After 1 week, you should feel just fine. If your sore throat is sort of lingering or getting worse, then there's a possibility that it's bacterial, and you could go to the clinic and have a throat swab done and a quick strep test. Now, see, in the old days, you used to have to wait for the culture to come back. I mean, you swab the throat and you have to wait 3 or 4 days to get the results. Now we have these rapid tests within 15 minutes, you know, whether you have strep, and you can get treated that way.
Well, those of us who go back to the old days and everything remember that. Okay, and final question. This one is a little bit on the gross factor. Apologies to those of you who are eating around dinner time right now, but can the color of your urine, or of a patient's urine, be indicative of the fact that they may have kidney trouble? Because I always remember kind of the joke was, if your pee is clear, you drank a lot of beer. Which means,
Well, I don't know about
and the science behind that being that, you know, you've got
Yeah.
a lot of, predominantly a lot of water and a
Sure.
lot of fluid in your system, thus, you know, you have a healthy kidney.
Sure. So you're right. Okay, the color of the urine is important. If your urine is coming out very darkly, dark color, tea color, then you have a problem. If it's coming out with blood in it, then there's a problem. And if it's very cloudy or frothy, then that's also a problem. So these things indicate the following: if you have frothy or cloudy urine, you're probably spilling a lot of protein there, and your kidney is not doing its filtering job, and you may get swelling.
Now, frothy meaning like a lot of
Frothy
bubbles or
meaning
foamy?
bubbles,
Okay.
foamy, yeah. Then if your urine is tea colored, very dark colored, then that may mean that you are somehow spilling a lot of bile in your system, or that there's old blood, okay, that from previous injury. And then if it's of course red, or you see red blood in the toilet bowl, then you have a problem there too, meaning you're losing blood either from a kidney stone or from some disease that is affecting your urinary tract. So we do look at the color of the urine, and I encourage you to do that when you go to the restroom.
And this all goes back to one of the very first things that you told us when this segment started 4 years ago, is drink 8 tall glasses of water every single day.
Do your best.
All right.
Make sure you're hydrated.
All right, so thanks so much. And
Thank
everybody,
you.
we are going to go to a commercial break, but please hydrate now. Go get some water, you know, drink 2